It's time now for Ask the Surgeon, brought to you by Everett Bone Joint. Everett Bone Joint, the best choice to get you back in the game. Learn more at everettboneandjoint.com.
Okay, well, as you can tell by the music, it's time for the Ask the Surgeon segment brought to you by our good friends at Everett Bone Joint. And joining us today,
Maury, is Dr. Howard Barker. He's an orthopedic physician here in Everett at Everett Bone Joint. And he's going to talk about ankle injuries today. And actually, Dr. Barker, how are you today?
I'm doing great. Thanks for having me.
You're welcome. You all have a fellowship, right?
That's correct.
So your fellowship is in foot and ankle specialty, right?
That's correct.
So tell us and explain what a fellowship is.
It's an extra year of subspecialty training after you've finished your 4 years of medical school and your 5 years of residency.
So you do 5 years of residency in orthopedics, and then you did 1 extra year in foot and ankle.
That's correct.
So 6 years total. Okay, so we're going to talk about ankle sprains, and just to start out, describe the anatomy and what is an ankle sprain?
As any type of sprain is an injury to a ligament, and a ligament is a tissue that holds bones together. And so an ankle sprain, the common ankle sprain, is the ligament that hooks up the front part of the fibula, the little bone on the outside part of your ankle, to the talus, which is the undersurface bone of your ankle.
everybody's grabbing their ankles right now.
Hopefully the outside of their ankle.
Yeah, cars are pulling over right now as we speak.
There's 20,000 common ankle sprains a day in the U.S., so it's really, really
tripping
common.
on the curb right now as we speak.
So it's very common. So generally speaking, most people will sprain the ligament on the outside or the lateral side of the ankle. What about the inside of the ankle?
Almost never is that sprained by itself.
Is that because it's just a bigger ligament and has more stability and mechanics just don't allow it to be sprained?
It's the mechanics of how your foot rolls. You imagine your foot never rolls out. It always rolls under and in.
So rolling your foot under and in irritates those ligaments on the outside. So tell us about the signs and symptoms. How would one know you sprained your ankle?
It's going to hurt.
It's going to hurt. It's going to hurt.
That would be number one, right?
And most of the time it swells. I mean, there's so many grades of ankle sprains. We classify it in 3 different grades, but really it hurts a little bit, it hurts a lot, or man, it hurts so bad I won't put my foot on the ground.
Do they feel a pop or a tear or anything like that?
Occasionally.
Occasionally they will. So with the sprained ankle, you talked about grading and classifying these. How do you classify them and grade them in severity?
There's 2 different ways, either with an MRI or clinically. Both of them are not very useful just because we treat them all the same initially with rehab and bracing and just giving it time to heal.
So rest. So if I had a grade 1 ankle sprain, because they grade them 1 through 3, generally speaking. Grade 1, describe grade 1, and then give us an idea what a grade 3 might look like.
A grade 1 is mildly swollen. It won't be loose. You won't feel loose. It resolves within a week. You'll be back playing all your sports probably within a week to 10 days.
And then you can walk on it. You can probably weight bear on it and move around a little bit.
And most sprains, you can put weight straight down. It's any weight that makes your ankle twist or turn that'll give you problems.
That's a good point. Now, grade 3, which is much more severe, you're going to have signs and symptoms.
Yeah, grade 3 is ugly. Most people think they've broken their ankle.
Okay.
Their ankle is huge. It's black and blue. It's swollen.
Is it worse than breaking your ankle?
In some ways, yes, just because ligaments heal back to scar and bones heal to bone.
Right.
So if you break the bone and it's not a terrible one, we don't have to fix it, then it'll heal back to bone and away you go. You'll be as good as you were. Whereas a ligament will never be as good as it was.
Interesting. Surgically speaking, on these a grade 3, would that person need to have that repaired, or do you just immobilize it, cast them? What is the treatment for the grade 3?
Yeah, a grade 3 sprain is treated with early mobilization. We get people moving as fast as it lets them, and then we get them into rehab, and either home rehab, physical therapy. The Wii is a great thing with the yoga part on that.
Really?
It is. The Wii Fit.
Wow.
Yes, it is. Yes.
Awesome.
It has a balance program on it where you can actually stand on it and you use your legs to balance, and that's
your insurance covers that then, huh?
Not yet. We're working on that. We're working on that. We're trying to get one in our clinics. We're actually thinking about getting Wii's in the clinics just for that very reason. It's great proprioception. And let's talk about proprioception, because I think that's an area in ankle rehab that in today's world we think about all the time. It's on the forefront, where 20 years ago when I was breaking in, we never really rehabbed proprioception. Can you describe that a little bit?
What is proprioception?
Well, that's a great question, and Dr. Barker is going to give us a synopsis here.
I know how to say that.
Proprioception is the ability for the body to know where a limb or a part is without you having to think about it, and the ability to bring it back into its normal plane without you having to think about it.
Wow. So would that be on the test, by the way?
After test,
okay.
you have to spell it first. Multiple choice, no more. Yeah. So proprioception is basically the ability for a person to walk on uneven surfaces and not have to stare at their feet and know what the foot is feeling on the ground, so the brain gets that sensation. And when you sprain a ligament, proprioception is impaired a little bit?
Yeah, absolutely, it's impaired. And there's 3 parts that hold your ankle together so that you're not rolling them all the time. One is the bony anatomy. Number 2 is the ligaments, and the third is the peroneal brevis tendon, which is a muscle that hooks onto a rope that hooks onto the side of your foot that pulls your foot flat again when you start to roll. And once you've injured your ligament, it's injured. Mm-hmm. That's it. It's not going to heal back shorter, and it's not going to, it's always going to be long. And so you have to really get that tendon to work fast, and that's fast and strong, and that's where proprioception activities come in.
So I have a question for you, Shannon.
Yes.
Is physical therapy treatment different depending on the different ankle sprain, the different severity of it?
Well, it's different from the standpoint of how fast we can progress people. I mean, a grade 1, obviously.
Epsom salt? They still use that?
Not anymore. That's Ma O'Kelley's way back in the day was Epsom salt. But with a grade 1 sprain, we can get these people moving, get them up, get them on their feet, start working proprioception, and return to sport-specific training. With someone who has a grade 3, we're going to spend more time working on inflammation, the swelling, black and blueness, getting the fluid out of there, and then gradually progress them. In the continuum of rehab, what we work on is controlling pain and swelling and then progressing. Obviously, someone with a grade 3 takes longer to rehab than someone with a grade 1. So, now, someone who has recurrent sprains, this happens frequently. These basketball players, these weekend warriors that go out and they roll these ankles, happens all the time. When do you consider surgery?
15% of people that have a sprain have a recurrent sprain, and 85% of those will get better with aggressive physical therapy and proprioception exercises. So that means we're 15% of 15% that need surgery. Not very many. It doesn't matter if you fix them early or late, and so obviously we fix them late because we don't know who those people are going to be early. And they do great after surgery. This is a very successful surgery.
Okay, so you're not probably seeing a lot of surgical intervention in young kids, high school athletes. You're probably doing more surgery in older adults.
That's not true.
Okay.
It's about equal. 16, 17-year-old, 18-year-olds who have recurrent sprains, they're miserable. They can't play any of their sports, and no bracing is going to help them enough.
So you'll fix those folks. Okay, great. You have a question, Maury?
I just wanted to say we're talking to Dr. Howard Barker here on Health Matters. He's the orthopedic physician from Everett Bone and Joint. I do have a question. Big football fan, played football in high school. Now the big thing in football, the big injury is the high ankle sprain. What's the difference between that and an ankle sprain?
Yeah, it's a different ligament. So it's the ligament that holds the tibia and the fibula together, the 2 bones of the long bones of the ankle joint. And it's caused by external rotation. So a foot's planted and the body twists around it, and it pops open the syndesmosis, which is the spot between those 2 long bones. It takes much longer to get back after a high ankle sprain, and the rehab is totally different.
Yes, I think Sidney Crosby missed like 39 games or something like that last season with the high ankle sprain. Yeah.
See, I think as far as sports goes, when I was asking if breaking your ankle is worse than a bad ankle sprain, it's worse just by when you tell someone you sprained your ankle and they're going, oh yeah, you'll be back really soon, when in reality you won't, So it's better if you have a broken leg with a cast on, so people will know, okay, he's not messing around.
He can't play yet.
You know what I'm saying?
Well, speaking of which, how long do you expect recovery and return to sports with a normal, let's call it a grade 1 or grade 2 ankle sprain versus a high ankle sprain?
Yeah, grade 1 is someone that I don't even usually see, and you probably don't either, Shannon, in your practice. Those are people who have a little twist, it swells for a day or 2, they know what it is, they get better. Grade 2, people with a grade 2 sprain, it takes them 4 to 6 weeks for them to get back to fairly normal activity, and much longer than that to get back to where they feel great. A grade 3 sprain, they're going to be out at least 2 months of any normal activity.
We're just talking about normal people, right?
Normal people.
Okay.
Well, or even high-end athletes. It takes the body that long to get it better. Now, they do a little different things. If you're making $5 million a year,
tape it up.
Right. Well, not just tape it up. They inject it up.
Shoot it up.
They tape it up.
Get out there.
Right.
It's okay.
So it's a little different. But for the rest of us, just going upstairs, it takes people, 3 to 4 weeks with a grade 2 and 6 to 8 weeks with a grade 3.
And what about high ankle sprain?
High ankle sprain is treated with some type of immobilization almost always. So a boot for 4 to 6 weeks, which really changes things because we don't want them to externally rotate and we can't brace that effectively. So that is going to be double the amount of time for the equivalent type of sprain.
So when you say boot, those are the big black boots you see people walking. Now, do you let them weight bear right away or put them on crutches?
They get a weight bear as soon as it lets them.
Okay, letting them, that means without pain and...
Yeah, the pain be their guide. And some people think they're just so tough, and usually the ankle wins if it's really hurting.
Yeah, exactly, yeah. You ever had a boot on, Maury? This is one thing...
You know what? I've never had a boot on because back in the day when I sprained my ankle, I don't think boot technology was around.
Or do they just tape it up then?
Epsom salt. I said that.
Epsom salt.
Yeah.
That's right. Yeah. Okay.
Yeah. But there's a pretty good study, 5-year randomized prospective study looking at normal ankle sprains, the low ankle sprains, and the boot, people who were randomized to a boot did worse.
Wow.
Oh, really?
Yes.
So then your
motion is good.
Motion is good.
Motion is good.
That's where the physical therapy comes.
There you go.
Get them moving.
It's all part of the plan.
Get them up,
type
get them walking.
Of brace and
Dr. Barker, thanks a lot for joining us today, and he's wearing scrubs. I think we should consider wearing scrubs.
I think
it's cool looking.
Camouflage. We should get camouflage
scrubs. You never know where we were.
Nobody sees you.
Yeah, exactly.
Awesome.
There you go, yeah.
If you wanted to know more information about Dr. Barker and all the fine people at Everett Bone Joint,